In this video, we'll talk about Courvoiser's law. It states this painless, palpable enlargement of the gallbladder, which is accompanied by mild jaundice, is unlikely to be caused by the gallstone. So, if the CBD is obstructed by any stone, how will it be? The gallbladder will be impalpable, shriveled, fibrotic, non-distended. Means the gallbladder will be very small, non-distended, fibrotic, shriveled, and impalpable. If the CBD has a stone, right? But if the CBD is obstructed by any tumor or the malignancy, the gallbladder will be distended and palpable. So, what does it states? This Courvoiser's law, the painless, palpable enlargement. So, this palpable enlargement of the gallbladder is seen in malignancy, not in the stone. In the stone, what will you see? You'll see non-distended, fibrotic, shriveled, impalpable. Means very small gallbladder. Whereas in the malignancy, you see large gallbladder, right? So, this painless, palpable, enlarged gallbladder accompanied by mild jaundice is unlikely to be caused by gallstones. Means it is likely to be caused by malignancy. It won't be gallstone, it is likely to be caused by malignancy. That is a Courvoiser's law. It's a law, so it has some exceptions also. We'll have to learn that exceptions, which are very important for the MCQ exams and also this university exams. You can remember every exception by this mnemonic, which is called doma coma, right? The D stands for double impaction of the stone at cystic duct and the common bile duct, right? So D for double impaction. And O stands for oriental cholangiohepatitis. And M stands for mucocele. And for A, for both the A's, remember, for both these A's, remember ampulla. So one, the stone is at the ampulla of Vater. So other cause is periampullary carcinoma in the patient with the cholecystectomy. So we are done with A, and then moving to the K, which is Claskin tumor. And O, obese patient. So gallbladder is situated beneath the liver in the obese patient. And M stands for Merizi syndrome, and A again, it stands for periampullary carcinoma in the patient with the cholecystectomy. So if we see the exceptions once again, D is a double impaction of the stone at cystic duct and the common bile duct. O is a oriental cholangiohepatitis. M stands for mucocele, and A stands for ampulla. So one is at the ampulla of Vater and second is at the periampullary carcinoma. And K stands for Claskin tumor. O stands for obese patient. M stands for Merizi syndrome. Right? So these are the exceptions of this law. So if you see the pictures, the first one is double impaction of the stone, one at the CBD and second at the cystic duct. Right? So double impaction of the stone. O is oriental cholangiohepatitis. So you can see this intrahepatic pigment stones also inside the liver, intrahepatic stones. And the mucocele, there is a distension of this gallbladder which is filled with the fluid. Right? Distended gallbladder which is filled with the mucus is called as mucocele. We'll also talk about mucocele in the next video. And the fourth one is stone in the ampulla of Vater. So this is opening is called as ampulla of Vater between the duodenum and the pancreas. This opening is called ampulla of Vater, which is a stone at the ampulla of Vater. And then Claskin tumor, the Claskin, it is a tumor which is present at bifurcation of this hepatic ducts. So this tumor is called as Claskin tumor. And the Merizi syndrome, the tumor is at the Hartmann's pouch, right? So it's called as Merizi syndrome. And in the obese patient, the gallbladder is beneath the liver. And in the periampullary carcinoma, again, this is a carcinoma in this region, right? So this is about Courvoiser's law. Again, remember this mnemonic doma coma. It will be easy to answer all the questions. So what does it say, this Courvoiser's law? It says that if the gallbladder is palpable, it is huge or it is distended, it is because of malignancy, not because of the stone. So what happens in the stone? If there is stone in the CBD, the gallbladder will be usually impalpable, shriveled, fibrotic, non-distended. But it has some exceptions. So what are the exceptions? If the stone is present at two sites like cystic duct and CBD, or oriental cholangiohepatitis, mucocele, ampulla of Vater, periampullary carcinoma, Claskin tumor, Merizi syndrome, or in the obese patient, in all these cases the gallbladder will be huge or enlarged. But there is no malignancy, it's because of the stone itself. But the stone which is present at different sites. So these are all the exceptions of this law. So this is about this Courvoiser's law. And also if you want to buy this PDF which contains all the important questions for university exams, you can text me on the Telegram. Bye.